Welcome to the deep dive. Ever wondered how doctors get such a clear, real-time look at your heart in action? Today, we're pulling back the curtain on echocardiography, that essential heart imaging test. Our mission is to understand what it is, why it's so incredibly important, and exactly what you might expect if you were to have one. Let's really get into this.
Absolutely. And it truly is a cornerstone of modern heart care. It's safe, it's non-invasive, and often, incredibly revealing. Imagine seeing your heart almost dance in real time, every beat, every valve opening, captured without a single cut or stitch. That's really the magic of an echocardiogram.
That's fascinating. So, okay, at its core, how does it actually work? How does it show us that kind of detail?
Well, it uses high-frequency sound waves. Think of it like sonar, but for the heart. It creates those live moving images. And crucially, there's absolutely no radiation involved, no invasive procedures.
That's radiation, right? That's important.
Definitely. This ultrasound camera, as you might call it, doesn't just show us what your heart looks like structurally. It shows how it actually functions.
Ah, okay. Function. Like what specifically?
Like its pumping strength, how well the valves are opening and closing, the size of its chambers. And it can even spot abnormalities, like, say, fluid building up around the heart or potentially dangerous clots.
So it's a dynamic picture, not just static. A functional assessment. Given that, what are the common reasons? When do doctors typically say, okay, let's get an echo?
Well, doctors frequently order one if someone comes in with symptoms like unexplained shortness of breath, maybe fatigue, chest discomfort, or swelling in the legs. It's also really vital if a doctor hears something unusual during an exam, like a heart murmur or other abnormal sounds.
Okay. And is it purely reactive for when something feels wrong, or can it be used more proactively?
Oh, absolutely proactively. Echocardiograms are incredibly powerful for monitoring known conditions. Think valve disease or heart failure. We can track how things are progressing over time.
Right. So ongoing management.
Exactly. And they're used to evaluate heart health before certain surgeries, or sometimes to track the impact of treatments like chemotherapy on the heart muscle itself. It's a key tool for management and sometimes even spotting changes, years before symptoms might show up.
Wow, that really connects the dots then.
Yeah.
Proactive insight. Now, for listeners, the practical side is always key. What's the actual test like? What's the experience?
Yeah, good question. For the standard type, the transthoracic echo, you just lie comfortably on an exam table. A technician applies a bit of clear gel to your chest that helps the sound waves travel.
Okay.
Then they use a small handheld probe, moving it around to get different views of the heart. The whole thing usually takes about, 30 to 60 minutes. It's completely painless.
Painless. That's good to hear.
Yes, no needles, no radiation, just the gel and some gentle pressure from the probe. Honestly, some patients find it relaxing.
That does sound pretty straightforward. Are there different kinds, like specialized echoes?
Yes, there are a few variations for specific needs. Sometimes we do a stress echo that involves exercise or medication to see how the heart performs under, stress. Or for really detailed views, especially of structures at the back of the heart, there's something called a transesophageal echo, or T.
T? How does that work?
For a T, a very small probe is carefully guided down the esophagus. It sounds a bit unusual, but it gives incredibly clear pictures because it's so close to the heart. We also sometimes use contrast agents, tiny microbubbles injected into a vein, or 3D imaging to get even more clarity if needed.
Got it. So once you have all these images, all this data,
Yeah.
what are the key things clinicians are looking for? What are the big takeaways?
The aha moments, right. Well, several key measurements. The ejection fraction is a big one.
Ejection fraction, what's that telling you?
It's basically the percentage of blood your heart pumps out with each beat. A healthy heart usually ejects over 50%, maybe 55%. So the single number gives us a really powerful snapshot of the heart's overall pumping power. Is it strong? Is it weak?
Okay, that makes sense. What else?
We look very closely at the valves. Are they opening fully? Closing tightly? Are they leaky or narrowed? We measure the exact sizes of the heart chambers. Are they enlarged or thickened? And we use something called Doppler imaging.
Doppler? Like for weather?
Sort of the same principle. It uses sound waves to measure blood flow. It lets us see how fast blood is moving and in what direction through the heart and valves. Super important for finding leaks or blockages. We can also spot subtle things like wall motion abnormalities, areas of the heart muscle that aren't contracting properly, maybe due to poor blood supply.
Wow. So this single test can really pinpoint a wide range of issues.
Exactly. Valve disease, different types of cardiomyopathy, heart failure, even some congenital heart defects people are born with. It really helps us map out what's going on. It's like having an internal GPS for the heart.
So what's the broader importance here for someone listening? Why should they really understand this test?
Well, it's invaluable because it supports prevention and early intervention. Many heart conditions develop slowly, quietly. An echo can often pick up changes early, sometimes long before you'd feel any symptoms at all.
Ah, so catching things early.
Precisely. And that early knowledge allows for timely treatment, maybe lifestyle changes, or just closer monitoring. It can genuinely prevent more serious problems down the road. And importantly, if your echo comes back normal, that's incredibly valuable too. It provides huge reassurance and helps rule out significant heart disease. Peace of mind is important.
Absolutely. So there you have it, a clear, non-invasive, really powerful window into your heart's health and function. Echocardiography seems like an incredible diagnostic tool, giving vital insights without needing invasive procedures.
It really is. Ultimately, whether it's used for diagnosis when symptoms arise or for proactive monitoring, an echo offers just unparalleled insight into your most vital organ. So maybe something for you to consider. How might really understanding your heart's health through tools like an echo empower your own personal health journey moving forward?